So if you have a herniated disc of the cervical spine, most likely you're experiencing pain. Pain in the neck with radiation down one or the other arm. You may have some numbness and tingling, but it's probably the pain that's driving you crazy. So the first line of defense, the first thing to do is to get yourself somewhat comfortable. And you're going to need some medications for that. Even if you're the type of person who doesn't like to take medicine, if you're having symptoms from a herniated disc, most likely you're going to have to think about taking medication. Most of these are prescription and it will require you to see your primary care physician or to see a spine specialist to get the prescriptions. So let's talk about the medications. There's 3 types of medications. 1 are the anti-inflammatories, 2 are the narcotics, and the third type are the prednisone-based or the steroid-type medications. The first line of defense, the first type of treatment, usually people try are the anti-inflammatories, and usually over-the-counter things like Advil, Aleve, Motrin. If you need to go to something stronger, you'll have to get a prescription, and those drugs are like Celebrex, Aval, Relafen, things like that come in a higher dose. Now there's risks with taking those type of medications, usually things like ulcers, bleeding in the stomach, and you have to speak to your doctor about that. But it's no problem usually just to start initially with things over the counter like Advil, Aleve, Motrin, maybe even Tylenol. So the first type of drugs is the anti-inflammatories. Certainly try those. If the pain is unremitting and not controlled by those, you're going to have to move right away into the second category, and those are the narcotics. Those are things with codeine, morphine, drugs such as Tylenol number 3, Tylenol number 4, Vicodin, Lortab, Hydrocodone, Percocet, those type of drugs, and they absolutely need a prescription from your physician. But those will help you and help you reduce the pain so maybe you can relax a little bit, get some sleep. The third type of medication are the steroids. These are prednisone-like drugs, and usually the prescription will come for something called a Medrol Dose Pack. It's a box with you open it up, there's a blister pack inside with pills. Usually the first day it's 6 pills, then 5, then 4, then 3, and 2, and 1. It's over a period of 6 days. You take this prednisone, and that will reduce the inflammation. That really does work in many cases and help. So with these medications, what we're trying to do is get you comfortable. Why? So we can buy time. We need time for you to heal. Remember, your body wants to heal. And also remember, your body can heal. Most of the time, in the vast majority of cases, if you have a herniated disc of the cervical spine, you can get better on your own and avoid surgery. But you need time. So for these few weeks while you're getting better, why not make yourself as comfortable as you can and use some of these medications? All the medicines have side effects. So speak to your doctor about that, and you have to weigh the risk versus the benefit. But use a combination of the medications to try to get yourself comfortable. And most importantly, remember, you've got to sleep. If you're up all night with pain, you're going to be useless the next day. You're going to be more sensitive to the pain. You're going to be crabby. You're going to be snapping at people. You're going to be miserable and miserable to be around. So use the medications, especially at night, to sleep. And try different positions. You may have to sleep in a recliner chair, but you've got to get some sleep.